skills in bandaging. In this chapter, we'll talk about different types of wound and skills in bandaging. There are 8 different types of wound. The first type is incised wound. It's caused by a clean surface cut from a sharp-edged object such as knives or glass. The edge of the wounds is cut evenly. Blood vessels are cut straight across, so bleeding may be profuse. The second type is laceration, which is most likely injured by machines, barbs of wires, and claws of animals. Lacerations are often contaminated by germs and more prone to infections. They are torn with ragged, uneven edges, and wound necrosis may occur due to ischemia. The third type is contusion. Causes of this type of wound include a fall, a blunt blow, or collision. Fracture may also occur. Contusion is a type of closed wounds. There may be no breaking of skin, but bruising and swelling around the wounds due to rupture of capillaries beneath the skin. The fourth type is puncture wound, which is a wound caused by a puncture of sharp objects. The wound has a small entry site but a deep track of internal damage to tissues and organs. The fifth type is abrasion that is often caused by a sliding fall or a friction burn. This is a superficial wound in which the topmost layers of skin are scraped off. The wounds may have burning feeling and contain embedded foreign particles such as dirts or sands, which is prone to infection. The sixth type is gunshot wound. It is caused by a bullet driven into or through the body. Therefore, there may be 1 or 2 wounds appeared. The shapes and sizes of the wounds depend on the types of bullets and the firing distances. Burns or infections may occur at the entry wound. Damage to tissues and organs may also occur. The seventh type is animal bites or insect stings. Any bites by snakes, insects, humans, or animals that break the skin have high risk of wound infection, intoxication, or even death. The eighth type is blast wounds, which are directly caused by explosives. These wounds can result in deeper damage such as necrosis or blasts of various tissues. Severe wound contamination and bacterial infection are typical in this kind of wound. To make first aid an effective one, it's very important for us to get known to the first aid equipment. First of all, we'll introduce first aid kit. According to Occupational Safety and Health Regulation, Chapter 509, Section 42, Number 18, there should be 1 or more than 1 first aid facilities maintained at the workplace, and that the first aid facility is clearly marked first aid both in English and Chinese. The items in the first aid kit include sterilized unmedicated dressings, adhesive wound dressings, absorbent cotton wool, adhesive plaster, medical gloves, triangular bandages, pressure bandages, safety pins, round head scissors, and a first aid manual. What are the uses of these different items in first aid kit? Wound dressings are clean objects covering wounds. They are soft and absorbent in nature. Purposes of wound dressings are to absorb blood and bodily fluids leaked from the wounds. They can also cover and protect the wounds, prevent bacterial infection, and facilitate the control of bleeding. If you can't find wound dressings, you can find some improvised dressings such as clean bed linens, handkerchiefs, towels, and triangular bandages. Next item is bandage. Bandages are used to maintain direct pressure on wounds, secure dressings or splints in place, and alleviate swelling. They can also support injured limbs or joints, prevent movements of injured parts, and facilitate the transportation of the victim. There are 3 types of bandages. The first type is triangular bandage, second is roller bandage, and third type is tubular bandage. Triangular bandage can be used as slings to support injured arms, and also be used to secure dressings, immobilize areas of fractures, and as soft pads. We'll now talk about how to manage wounds properly. First, help the victim to sit or lie down in a comfortable position. Expose the wound to check if there are foreign bodies embedded. Then, irrigate the wound with a lot of clean running water. After that, cover the wound with clean dressing. Apply direct pressure to stop bleeding. Bandage the wounds after bleeding has been stopped. Lastly, remember to examine the distal blood circulation and prevent or manage shock. Finally, we'll demonstrate how to bandage wounds of external bleeding.
Reef knot. Take the left end over the right and cross them to make a knot. Then, take the right end over and cross them to make another knot. Put the ends firm to tighten the knot. Pull one end of the knot off and the knot will be untied. Large arm sling. Rest the victim's injured arm against the victim's chest and ask the victim to support the injured arm with the victim's other arm. Slide one end of the triangular bandage between the body and the injured arm under the elbow. Pull the upper end of the bandage from the uninjured side around the back of the neck. Bring the lower end of the bandage up to support the injured arm. Tie a reef knot over the collarbone on the injured side. Keep the forearm in a horizontal or slightly raised position. Tuck the ends of the bandage under the knot. Adjust the sling to expose the victim's fingers. Now, tie the untightened sling by twisting the excess bandage of the point at the elbow. Then, tuck in the secure. Alternatively, you may fold the excess bandage and then secure it with a safety pin. Or secure with adhesive tape. The bandaging is now completed. Check the peripheral circulation, sensation, movement, and pulse of the injured limb. Elevation sling. Rest the victim's injured arm across her chest with her fingers pointing at the collarbone. Then ask her to support the injured arm with her other arm. Lay a triangular bandage over her arm with one end pointing towards the elbow and the other end points towards the fingers. Tuck in the base of the bandage. Take the lower end of the bandage around the shoulder blade. Then, bring back to the collarbone area. Use a reef knot to tie both ends of the bandage. Tuck the ends of the bandage under the knot. Now, tie the untightened sling by twisting the excess bandage of the point at the elbow. Then, tuck in to secure. Alternatively, you may fold the excess bandage and then secure it with a safety pin. Or secure with adhesive tape. The bandaging is now completed. Check the peripheral circulation, sensation, movement, and pulse of the injured limb.